Hi, my name is Andre Motuz and I'm acupuncturist. I treat in London and Watford. So originally I studied traditional Chinese medicine, and then I continued my studies with 5-element acupuncture, and then I actually finished my degree with integrated Chinese medicine, which puts together both Chinese medicine, TCM, Chinese medicine, and 5-element, or worstly 5-element acupuncture style. What normally happens when you come for acupuncture session, we'll do a diagnosis based on your pulse taken. We may check your tongue, and we also palpate the abdominal area, and we'll be able to distinguish what is a symptom and what is the root cause of a potential problem. So in acupuncture we have about 400 points on average that we use there all around the body. It's a really ancient style of medicine. So we know that there is these energetic lines on the body called meridians, and what we're trying to do, we're trying to establish a balance in them. So if there is too much flow, then we're trying to reduce it, and if there's a lack of flow, then we'll try to stimulate it and increase the flow. When you come for a session with me, we can use several tools. Obviously the most common one is the acupuncture, but we also have a moxibustion or moxa, which is the herb called Artemisia vulgaris or mugwort. We may be able to heat up the acupuncture point with this particular herb on the skin. We also have a cupping and gua sha. And one of the other tools that I use it's a massage or a shiatsu or a tuina massage. So there's a different form of massage or a trigger release therapies that I do. So for those of you who already had a acupuncture, you might have the experience with the high street or common TCM, where the acupuncture often feels quite painful and there's a strong sensation in your body. There's another acupuncture style called Toyohari, which I also use, and this is a very useful technique because we don't actually insert the needles. So 95% of the time we are able to increase the energetic flow or decrease it, whatever we need to do, with just needles very, very close to the skin, but without actual penetration. So in acupuncture we have this wonderful system called the 5-element cycle. So the traditional elements are fire, earth, metal, water and wood. We would normally recognize the imbalance or symptomatic issues relating to a particular element, be it an earth, for instance, indigestion, weight issues. We don't always necessarily treat the particular symptoms, but we'll look at the relationship these elements have. So each element will correspond to a particular organ. So say wood organs are a liver and gallbladder. So if there is an overactive liver or gallbladder, it will have a natural influence on the element earth, which is stomach and spleen, which are responsible for digestion and production of the nourishment in the body. So if we will relax the element of the wood, or if we would basically, depending on whether there is too much energy or too little, then naturally that will influence the earth. Let's take example of the anxiety. So anxiety from Chinese point of view often takes the form of fire raising, or there's a constriction of the chest, there's issues going on with lungs, there may be palpitations and so on. So how does it actually work is, we have an understanding that water controls the fire. How does that work is if we strengthen the kidneys or bladder, automatically we'll be able to control the element, the heart and small intestine. Acupuncture is really useful because it can change the state of the patient so fast. I've never seen any other tool before to be able to really understand the principles on the body so much. I'm able to engineer health from point of view of a Chinese medicine. I have a background in cognitive behavior therapy. Feel free to contact me for a free 15 minutes consultation. We can discuss wherever you need advice about your lifestyle, or wherever you just want to see if acupuncture actually could work for you. I'll be really happy to discuss.